As I said, we aim to identify the pattern of risk in CKD patients and approximate the direct impact of pandemic on them. And for that, actually, we've gone through 4 major steps that I'm going to talk about in the following slides. In the first step, we identify the most prevalent comorbidities across CKD patients using Calibre phenotyping algorithm, and thanks Calibre phenotyping library for providing such reusable and validated phenotypes. And and by actually identifying the most prevalent comorbidities, we could see comorbidities burden across CKD patients, and we found hypertension and CVD are the most prevalent conditions among CKD patients. Using this information, we've estimated the baseline risk of mortality by key demographic risk factors, and we found that number of comorbidities, age group, and stage of CKD together impact the baseline risk of mortality for CKD patients, and consequently their vulnerability to an infectious disease, in particular pandemic and coronavirus. Using the estimated risk and a model actually developed by Professor Amitava Banerjee and published in Lancet, we estimated the excess number of deaths in CKD patients by age group. And this is actually the third major steps that we've taken to measure the direct impact of pandemic. And after that, we validated our model using the NHS-TRE data, and for which we actually created a cohort of CKD patients. We identified all the prevalent CKD by the onset of pandemic. For them, the infection rate and relative risk by age groups were calculated. That, as you see, vary significantly in different age groups. And we observed that what was predicted by our model actually was very close, both in terms of absolute number to the real data, and also in terms of the distribution of age group for those people who died actually because of coronavirus. And once we can predict very close to the real observation, then we can actually control over the policy and guidelines, and that's the ultimate goal of this research, that actually impact on some policy and guideline for post and prioritization of the pandemic. And also we may need further examination over medications and other factors for hopefully devising a stratified treatment pathways, and it could be a key for the next step toward precision medicine. Thank you.